Senator Kaine.
Thank you, Mr. Chair, and thank you to the witnesses. Dr. Fauci, I saw an interview with you last week where you talked about a concern that there's too sizable a percentage of our population that sort of doesn't like science and scientists and advice from scientists. And I hear real emotion in your voice as you express concern about people gathering in large groups and without masks. And I gather that's the kind of anti-science concern that you were worrying about when you had that interview last week.
Yeah, that is part of it, Senator, yes, because a disregard of recommendations that come from authorities only because it's a recommendation. I think the attitude of pushing back from authority and pushing back on scientific data is very concerning. We're in the middle of a catastrophic outbreak, and we really do need to be guided by scientific principles.
And this could cause problems down the road if we get to a vaccine, but people don't want to get the vaccine. So we all have to message this pretty strongly. Dr. Redfield, I want to thank you. I was going to ask you a question today that I've been asking over and over again. Why does the CDC's guidance for institutions of higher education not even mention the word testing? But as soon as your testimony was done this morning, the CDC website changed. And there are now guidelines for the institutes of higher education with fairly extensive recommendations and guidance, not mandates about testing. I didn't have a chance to read them, but I saw them popped up on the CDC website, and I wanted to thank you for that. Your testimony, Dr. Redfield, today, and some of the written testimony talks about the fact that the public health system relies on timely and accurate data systems, but that we've underinvested in them. And the crisis has, quote, highlighted the need to continue efforts to modernize the public health systems. Last year, I introduced a bill called the Saving Lives Through Better Data Act. It was with Senator Isaacson and Senator King. And colleagues were helpful in this. We were able to get $50 million in December in the appropriations deal, and then another $500 million in the CARES Act. But I would urge my colleagues to do even more because the request from our public health communities is significantly more sizable. I hope we might be able to get that into a next COVID package. Dr. Fauci, this is a challenging question, challenging how to figure it out. The CDC last week said that a new group that we have to consider at risk is pregnant women and lactating women. The NIAID's remdesivir testing and vaccine testing often doesn't include pregnant women, I think for some safety reasons. But we would want to make sure that pregnant and lactating women have access to treatments and access to vaccines. So how will we be trying to do research and testing so that the women can safely access these treatments or vaccines?
That is a great question. It applies also to children. So what we're doing with the vaccine is you do a phase 1 trial in normal, healthy adults, not pregnant, not children, and you show initial safety. Then when you move into this phase 2 and 3 studies, if you get even the slightest glimpse of efficacy and safety in that population, you go back and do a phase 1 in pregnant and lactating women as well as in children. And if that is safe there, you bridge the data so that you could use the efficacy data that you already started to apply back to pregnant women.
I see.
That's how you do it.
Let me ask you this. At this point, is the nation's goal with respect to coronavirus to mitigate it or suppress it?
You know, vaccines right now, you're talking about vaccines, sir?
No, I'm just talking about what is our goal? Are we trying to mitigate or are we trying to suppress?
You know, it depends on where you are. There's containment and mitigation. So if you have a level of virus that's low enough that you can adequately contain by the standard way of identification, isolation, contact tracing, particularly if you make sure you link the identification with isolation, because if you just do contact tracing without isolation, it's not going to work. When you get into a situation...
If I could, Dr. Fauci, because I don't want to go over time, I want to say just one thing about testing real quick. Admiral Girard, when you were here last, you said we would have capacity to do 40 to 50 million tests a month in September. That's about 1.3 to 1.7 million a day. On May 12th, we had done about 310,000. Yesterday, we did 560,000. Are we going to get to 1.3 to 1.7 million tests a day by September?
So thank you for asking that. We will absolutely have the capacity to do that. It's depending on the need. And again, as you might expect, a few weeks ago, the need for testing was much less than it is now. We had a good system that it was actually very good that we were able to identify an increase in positivity very early. But obviously, with the outbreaks we're having now, we need to massively surge testing in those areas. We will have that capability across the board. And yeah, we'll have that. And that's assuming no pooling. When we start pooling these together, 3, 4 tests, then you do the math. So I'm never going to be happy until we have more tests that we never have to say the word test again, but we're going to be in reasonably good shape given those parameters.
Thanks, Mr. Chair.
Thank you, Senator Kaine.